Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you so much for joining me, Ellen Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to have as our guest Dr. Kevin Spelman, PhD. He does phytochemical research about health and education. Dr. Spelman is a molecular biologist, phytochemist, clinician, and herbalist who has worked with medicinal plants in the field, in the clinic, and in research models, including clinical, human trials, and preclinical models. He has practiced phytotherapy at several clinics and was a co-founder of the first fully accredited Masters of Science degree in clinical herbal medicine. As a postdoctoral fellow at the National Institute on Aging, he researched the molecular biology of brain and ovarian cancer and predicted and demonstrated novel phytocannabinoid lignans. Dr. Spelman was a Marie Curie Research Fellow at the EU in the EU researching medicinal plants against malaria. And he has a long, beautiful bio, and we're so happy to have him on board today. These days, he's very involved with the Spelman Report at thespelmanreport.com, and we'll have live links. So if you're listening to the show live, then visit the archive, and we'll have all the links there for you. So thank you so much for joining us today, Dr. Spelman.
Well, thank you, Ellen. It's a pleasure to be here.
Let's go back in time, because what made you venture into the world of herbalism?
That's a great question. And I would say my journey is probably similar to many others. It started really for me in terms of my own personal health. I wasn't a greatly healthy child, and so I started looking for answers pretty quickly due to the dissatisfaction of what I was getting from the conventional healthcare system. So as soon as I broke away from my upbringing, I started experimenting with herbs and micronutrients and really learned as much as I could whenever I had the opportunity.
So you found that some of these natural remedies had an answer for you or were able to support you in getting well early on.
That's right. And answers is a good way to put it. In many cases, I found effective relief from what I was dealing with by experimenting and diving into and researching what was available at the time. And remember, this is before the net. If any of you listeners out there could even imagine a time, this is before the web. So it was a lot of books, a lot of book learning back then.
Yes. For instance, Dr. Spelman, I've been an herbalist since 1964. And in those years, there was definitely no net. So I spent one day a week in the medical libraries. And I was able to find, even back then, so much research about herbal medicine in a lot of the older medical journals.
Yeah, that's right. That's exactly right. I had the same experience, especially when I was practicing. I was going to the University of New Mexico's School of Medicine library, and unfortunately, many of the articles I was looking for weren't available. So I learned a lot about interlibrary loan back in those days. But the farther back you go in the scientific journals, the more you see herbal medicines show up, medicinal plants being researched for any number of serious diseases or their chemistry or their extraction processes. Unfortunately, there's less and less of that. However, there has been an increase just in the last 10 to 15 years. Herbal medicines are really starting to be looked at in a much more serious way. And I think one of the reasons behind that is actually the gateway drug, so-called, and I don't believe that that's what cannabis is, but that gateway, it has really been a gateway to showing physicians that medicinal plants have value. So we have a lot to, in the medicinal plant field, I think we have a lot of gratitude to give to cannabis, because it's open to a lot of healthcare providers' minds and the ideas that they think about how to use plants in treating various illnesses.
Well, I believe that's true, and perhaps that's how I came upon your research, because I am on the education committee of the American Cannabis Nurses Association, which is the group of nurses very much involved with the medicinal use of cannabis.
And let me just give a shout out to that. That's fantastic. I think that, and there are physicians now that have these sorts of memberships as well, and missions to study and understand cannabis and to disseminate good quality information. But I love that you frontline workers, the nurses, are actually doing it. It's well needed.
So much so. But really, you, as you know, because you've been doing this a very long time, there was a lot of research done, like you said, especially during the time of when they used the national formulary and other kinds of pharmaceutical doctrines about how to correctly extract actives from plants. So it was somewhat certainly sublimated then in the 50s and 60s. But I think you're doing very important work to actually bring evidence back to evidence-based practice in terms of using phytomedicines.
Well, thanks. I appreciate that. By my nature, I am a research scientist, but by my profession, I'm actually an herbalist. So putting those two together, it made sense to go in that direction. Let me just say that, I've heard from certain elements of the herbal community that we don't need science and we don't need evidence-based, but you got to think and stop and think about this. If one-on-one with patients, I think it's one thing, but when you start treating masses, when you have products out there that can get to millions of people, it's the time you really want to be thinking about science and quality control and efficacy and the pharmacology and how it's working. And I'm a big proponent of looking at things in a scientific manner.
Me too. And yet, I do understand what you're saying. There are many people involved in herbalists. As herbalists, they often associate themselves, let's say, as what might be called a community herbalist. And there's actually seems to be, like you said, Dr. Kevin, some kind of thought form against looking at things on a more scientific evidence base. But I don't see any reason why those two things can't be working simultaneously.
Well, I like to think of it as being bilingual, right? When you speak one language, that's great. You have a way of communicating. When you speak two languages, not only do you have different words to express yourself, but you have different conceptual frameworks to express yourself. And I would say the same about having a scientific perspective as well as a traditional medicine perspective, whether it be Ayurvedic medicine, traditional medicine, Western herbal medicine. Combining those two, I think, makes people much more agile in terms of dealing with patients.
So I know you're bringing all your research and making it available to people in various ways. And one way is you put together an audio science journal called the Spelman Report, PhytoPharmacology Review. How does that work?
Well, I was, first I must say I was inspired by Jeff Bland, who did a program that went through many different iterations and names, but I think it was called Functional Medicine Update for the longest period there, where Dr. Bland would basically go over scientific concepts and new research, thinking about nutrients, and then he would end the program with an interview with a key player, a key influencer, sometimes Nobel Prize winners. I was so touched by his program, and I listened to it for over 20 years, and I learned an incredible amount. So I felt like it was a good way to give back and to mimic that program, except focusing on herbs for the most part. I do talk about nutrients and nutraceuticals, but Phytopharmacology Review is really a way of educating the community and educating the community and really helping bring more scientific validity to what we do, and perhaps a better way to dialogue with physicians as well. And I do have, interestingly, most of my subscribers right now are MDs. I thought most of my subscribers would be herbalists, but MDs are really hungry for this information.
That is true, because their clients come in and say just what happened to you personally, Dr. Spelman. If you are seeing a physician and if you say, gee, I read some research, very high level research about this herb for a condition that I have, I'd like to try it. And if the doctor says to you, natural remedies are unproven and don't try it, and they have no evidence based and they have no history of use, truthfully, I would suggest that you fire your physician. But if your physician says, to tell you the truth, I can't help you with using that kind of therapy because I am not knowledgeable about it. However, we can work as a team. You come in here, I will do your vitals, I'll do your measurement, I'll see how your high blood pressure is doing or whatever it is you're working on. You try that natural thing on your own. I can't tell you what to do with it. I'm not trained. And let's see how it works. Then, yes, that is a doctor that you want to have as part of your learning team. Because as Dr. Spelman said, physicians have not been trained in botanicals unless they're very old. I did a radio show this morning with a physician who, a matter of fact, and we had him on this show as well. And he is the person who invented ACE inhibitors, Dr. Spelman.
Oh, my goodness.
Yeah, he is brilliant. And now he does an entire evidence-based procedure looking at foods as medicine. And he got to that path strictly through the science of what goes on with plant medicine. So I think there's a real revolution, like you're saying, of not only individuals, but medical doctors, although they have not been trained in this. There's a way to get trained in it. And one way is to attend the classes that you're giving there. And it's called the Spelman Report, and anybody can join in. You don't have to be a doctor to join in. But I'm a very, very avid interaction with Dr. Jeffrey Bland, because he and I, along with Dr. Serafina Corsello and Robert Atkins and a whole group of alternative physicians, because I was Dr. Corsello's head nurse for 23 years, and together they worked on putting together various projects such as ACAM, if you ever heard of that, which is a chelation professional society. So I'm very involved with Dr. Jeffrey Bland and his work. And you're right, those presentations were just so illuminating and refreshing. And really, what I think should be not called alternative medicine or natural medicine, I believe, with all the evidence, like what you're providing as well, we're just talking about good medicine.
I completely agree. And I think that's a good way to put it. It's not alternative. It's not complementary. It's medicine.
Yeah, because shouldn't it be with any kind of person dealing with any kind of health imbalance that first we use that which costs the least, is the most effective, with the best adverse effect profile. And if you look at that as parameters, then what we might call natural interventions like lifestyle, food, herbs, and I'll add in homeopathy, nutritional supplements when needed. I'm a big believer in testing first and doing targeted supplementation and then retesting to see if it's getting absorbed, etc. And what's so wonderful about herbs is you're not getting those isolates. You're getting a full plant that has chemical reactions that we don't always get with isolates. So all of that. And then if the person doesn't get well, there's always time for pharmaceuticals, which are heavy-handed, often needed, but have a high incidence of adverse effects. But we can always go there when needed. It just shouldn't be the first and only tool in a physician's toolbox.
I couldn't agree more. I absolutely agree. That's what we should be doing. And there's advantages and disadvantages to medicinal plants. And
let's talk about them, because you're the expert there. Let's talk about exactly that. What are some of the advantages and disadvantages of medicinal plants, Dr. Spelman?
Well, in my perspective, the advantage of medicinal plants is that they're broad spectrum and naturally dilute. On the other hand, the disadvantage of medicinal plants is that they're broad spectrum and naturally dilute. So let's unpack that a little bit. So by broad spectrum, we have to really look at what that means. So let's start back in an evolutionary perspective. We know that plants cannot pick up their roots and run away, right, to defend themselves. So they really have to have some sort of defense that does not involve fleeing. So they fight, and they fight chemically. And their defensive compounds, known as metabolites, or what many call phytonutrients today, they hit many different targets due to an evolutionary imperative to protect against all kinds of invaders. So think about it. Not only did plants have to deal with herbivores, but they had to deal with parasites, they had to deal with bacteria, they had to deal with virus, all without moving away. So each molecule that a plant builds to protect itself is at an expense. They burn up ATP to make molecules. So if they could produce a molecule that could act against multiple threats, they were likely to be selected to survive. Their evolutionary trajectory is going to be much better than a plant that just made one molecule that only did one thing or acted against one type of invader. So I think that's a really key piece to understand about the broad spectrum side of it. The biggest argument I can make for the safety of plants is that they are naturally dilute. Think about pharmaceuticals. Usually they're an isolated compound that, however effective it is, it's a lone actor in the body. And consider how often humans came in contact or ate just a single molecule, like a pharmaceutical. Except for exceptionally rare circumstances, this was not common. This was the exception. The rule, however, was that we consumed chemically complex stuff. When we were walking around in our early evolutionary days, putting things in our mouth, they were always chemically complex. They weren't just one molecule. And so by understanding that any one molecule doesn't have the greatest power because it's concentrated, but it's diluted with all these other molecules, that in itself creates a safety buffer. And if you really look at plants, and we'll, excuse me, we'll take cannabis as an exception here for a moment. But if you really look at plants and consider their concentration of any one molecule, it's rare that anything's above 10%, and it's more common that stuff really comes in at 5% or less. So think about that for a second. So when you consume a plant that's not standardized, what you're really getting is more of a food-like substance. You're getting something that has hundreds, if not thousands, of molecules. And in doing so, considering that these plants have evolved with mammals eating them, including humans, doesn't it make sense that some of these molecules actually might be incredibly beneficial? So if we think, for example, about flavonoids, which are fairly ubiquitous, for example, quercetin, which is used for allergies rather successfully, is probably in almost every plant on the planet. A very ubiquitous flavonoid. And if you look at the research on flavonoids, what we find is that they decrease the risk of strokes, they decrease the risk of cardiovascular disease, they have a anti-cancer effect. They're actually quite helpful. And yet pharma calls these things pains, which basically there's polyphenols that hit a lot of different targets. And so pharma actually rules them out when they go looking for a new drug to hit a target because they think they're, well, a pain in the butt. They don't want to deal with something that's going to screw up their assays, which is really rather sad because we've evolved with these molecules, and our genes have come to understand many of these plant molecules through literally millions of years of evolution. So when I think about naturally dilute, I think of something like a food or a medicinal plant, and that has safety built into it because it is naturally dilute, and it's just not just one molecule that would be easy to overdose on.
Well, that makes sense because it's not something that's well recognized in nature. So I'd like to remind you listeners that you are listening to Herbally Yours on the voice of Nassau Community College 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and my guest today is with us talking about higher levels of plant consciousness and plant understanding. And he is Dr. Kevin Spelman, PhD. His website is phytochemist.com. And also he runs the Spelman Report, which is a great place to get information about the latest science in the world of herbal medicine. He also has a Facebook page, the Spelman Report. So Dr. Kevin Spelman is a molecular biologist, phytochemist, and clinician and herbalist, and he's talking to us today about various aspects of really understanding how and why herbs work the way they do. So, Dr. Spelman, do you feel that people actually also need something like a multivitamin pill, which is really just a bunch of chemicals put together rather than a whole plant? Or can people get everything they need from choosing the right food?
Great question, Ellen. And I would strongly suggest that we can't get what we think we can from our food anymore. And there's a number of reasons behind that. But let's start with the very famous and prolific researcher, publisher, Bruce Ames. Bruce Ames was actually a brilliant scientist. To this day, we still use a lot of the tests he invented in the lab, for example, with cancer. But Bruce Ames used to say that for pennies a day, we could solve a huge burden of disease across the planet. And what he was talking about is by having people take a multivitamin every day would basically take care of so many disease processes. And I have to agree, the human body needs about 24 different chemical elements. And we aren't getting them from our food the way that we used to. And so let me dive into that a little bit. There's been a number of studies showing that the crops that we eat, which by the way were bred for volume of crop that they produce, not bred for nutrient levels. And that's an important point. That these crops are showing a decrease in micronutrients due to our farming practices, as well as the cultivar selections. By cultivar, I mean the particular type of hybrid that they're using. If you look at historical food composition data found like in older types of crops, what we currently see is declines of somewhere between 5% to up to 40% or more in some minerals in groups of vegetables and fruits. One study also noted that there was less protein involved. Also, recent side-by-side plantings of low and high yield cultivars of broccoli and grains found consistently negative correlations between yield and concentrations of minerals and protein. And this is really a newly recognized genetic dilution effect. If we look at some of the garden crops that people grow, there's statistically reliable declines for about 6 nutrients. Protein is one, calcium, phosphorus, iron, riboflavin, which of course is B2, and ascorbic acid, which is vitamin C. These declines range from about 60% to about 38% for riboflavin. So there really is a huge issue here. And by the way, climate change may actually make this worse. Relative to pre-industrial times, modern plants are really in danger. They're experiencing a global elemental imbalance. And this imbalance basically has the potential to affect the nutrient levels of plants. And aren't plants the most important food source on Earth? So we really need to take this seriously. And, people that tell me, we can get everything we need from our food, it's just not accurate anymore. We're not getting what our ancestors were in terms of nutrient levels.
Well, another thing, besides that is our ancestors usually didn't live to 80 or 90 years old like we are. And by the time you get to that point, you certainly, may need supplementation to keep all the nutrients that you may need to keep going as we age. By the way, my own parents, like my mom who's 92 and just went swimming right now for like a mile and is on 0 medications because I use quite a bit of supplements and herbs for her and myself. I'm about 20 years behind her. So really, we do use a lot of those therapeutically to avoid systemic breakdown and try to stay off pharmaceuticals. That's the goal.
Yeah, and I think this is something that Dr. Bland brought to my awareness are SNPs, single nucleotide polymorphisms, just a slight change in our DNA, one base different. And these SNPs are extraordinarily common in the human genome.
Well, you know what, Dr. Spelman, we can't go into them because unfortunately we're almost at the end of our show. Let's let our listeners know the best place to find you if they want to learn more about the science of herbal medicine.
Probably the best place to find me is on my website, thespelmanreport.com. That's probably the best. You can also, I'm on Facebook, The Spelman Report. I'm on Instagram at The Spelman Report, and Twitter as well. So I should be easy to find out there.
Well, thank you so much for doing all that work to bring the real science, the evidence to all the use of these many natural therapeutics. And that's a wonderful, wonderful goal that you're working towards. And listeners, I want to thank you for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.